Today's health tip, muscle up to stay alive. Sarcopenia means low muscle mass. And it's really important because we found that it is a predictor of death. So this is what this study says. Sarcopenia as a mortality predictor in community dwelling older adults. So we're talking about healthy older adults. And basically the study showed that in healthy older adults, muscle loss is the leading predictor of death from all causes. You have a 2 times higher risk for death if you have sarcopenia. And it's not just losing muscle mass, the actual amount of muscle that you have. Low muscle strength is also going to be bad for your health. And this study showed that independent of the adopted criteria, people with low muscle strength and normal mass, they have a normal quantity of muscle, they have higher mortality risk, higher risk for death compared to robust individuals. So muscle strength and the amount of muscle both are really important for your health. Now, as you grow older, unfortunately, you have something called anabolic resistance. And this means that your body resists building muscle. And so it's really hard to make more muscle as you age. Beyond the age of 40, most people will start having anabolic resistance. If you're generally not very active, sedentary, you have a desk job, that may start as early as your 30s. So when you have anabolic resistance, not only do you have trouble making new muscle, you have trouble preserving muscle. And as the years pass, you start to lose muscle strength. You also lose muscle mass. So the translation from this study is that you are less able to make muscle as you age, and this is called anabolic resistance. So we find that if you're not getting enough proper nutrition, you're also going to have accelerated muscle loss. So a lot of times the recommended daily allowance for protein is 0.8 grams per kilogram per day. And what this study here is showing is that most older adults now need between 1.2 and 2 grams per kilogram per day of protein to make sure that you minimize muscle loss. And it looks like most people are under this value. So the translation here is you're not eating enough protein. What action steps can you take to prevent excessive muscle loss and to keep on as much muscle as possible as you age? You want to get 25 to 35 grams of protein per meal. And I emphasize per meal. A lot of times my patients will come to me and say, "Oh, Dr. Lowe, I eat lots of protein for breakfast, for example. I have an egg." Well, that one egg is 7 grams of protein. Do the math to see how much you would need, how many eggs you would need for 25 to 35 grams of protein per meal. And I much prefer animal sources, so meat, eggs, fish, and dairy, because you get better whole protein. You're not going to miss out on any of the amino acids that may be essential. And the other thing with animal sources, it's much more bioavailable to your body, so you absorb it better and your body can use it better. You should eat a protein meal at least 4 times a day because you want to aim towards 140 grams of protein a day divided equally across all meals. And the other thing you should focus on is full body weight training or resistance training 3 times a week. Many people will tell me, "Oh, Dr. Lowe, I exercise. I get on the elliptical machine or on the treadmill. Maybe they go for a brisk walk." Those things are great. However, for you to maintain muscle mass, to build more muscle, you're going to need to do weight training 3 times a week and just prioritize keeping as much muscle as you can. So if you have any questions, leave me a comment below and I will try to get to them and answer them to the best of my ability. Take care. Bye.